I'm going to present a case study today, an interesting patient. A lovely 47-year-old gal came to see me from Nashville. And it's a kind of a funny story, but it turned out to be not so funny. She and her husband were putting together a Murphy bed, and the Murphy bed was up on the wall, and the spring-loaded mechanism flipped down and hit her in the back of the head and knocked her down and broke her jaw, knocked her unconscious, and broke her neck. And she went to the big university there in Nashville where they did a massive fusion. I'm going to show you the films in a minute. And this was in October of 2024. It's now March of 2025. She called me in December and said, I can't move my neck and I'm in pain. Can you reverse this fusion? They've done a massive fusion on my neck. So I got her images and they put screws all through the back of her neck. The muscle had separated off. The bones were sticking out not of her skin, but pushing her skin out like a dinosaur. And so she was in pain and her head was pitched forward. So she wondered if it was possible to reverse some of these fusions and restore mobility, what we call restorative motion surgery. So indeed, she was a good candidate. They had not damaged the facet joints and they had just fused over them. So I did a CAT scan 2 days ago. I saw her 2 days ago. We operated yesterday, removed all the fusion and all the screws out of the back of the neck, reconstructed the muscle and tissues in the back of the neck to give her a pretty wound. So I found out young women don't like ugly scars. It's weird. So fixed that and then turned her over, went in the front of the neck, fused the one level that had fractured with a plate and screws, and did artificial discs above. It was one disc was degenerative, the other was injured. So she has full motion back, and they had fused her from cervical 4 to thoracic 2 to the upper thoracic spine. And I remobilized thoracic 1, 2 and C7, T1. So basically she's got everything back except for one disc is fused versus 6 discs being fused. So it's really restorative motion. She's exquisitely happy today. And I will show you her x-rays from this morning. This is the x-ray of her neck standing in neutral position. And if you notice, her head is a bit forward over the shoulders. Cervical 2 should be more centered close to thoracic 1 here. So she's pitched forward. You see where she broke her jaw. They have screws in her jaw. And they did this massive fusion, which isn't wrong. It's just very extensive. And in my opinion, her only fracture, and you can see a hint of it here, is at cervical 6, 7. This is her front view, and you see that they've went all the way down to thoracic 2, thoracic 1, and then go all the way up here to cervical 4. Now this is flexing the chin down. You see that nothing moves, and then that's extending the head backward. She's very stuck, very little mobility, and that was her main complaint. I can't move my head. She has chronic pain, and the bones were sticking right up under the skin, and I'll show you a photograph of that. Here's where the surgery was done through the back of the neck. You can see the bones are sticking through the skin. The fascia of the muscle is separated off to the side, so the muscle is pulled down, and her head is pitched forward. You see where they cut her hair here. So we revised all of this scar. I'll be able to show you that in another picture next time. As you can see here, I've removed all of the screws and rods and all the bone fusion mass. I verified on the CAT scan that the bone had not fully attached and that they had not damaged. See these lines? These are the facet joints. These need to be intact for the disc to move properly. So her facet joints were not damaged by the surgery. The bone graft was partially attached in areas. We were able to remove all of that and to get her disc moving. So I did fuse the one that had the fracture of cervical 6-7. There's an inner body graft in here. It looks invisible now, but it'll fill in with bone. This is the plate and screws. Artificial disc above to give her full mobility. Now I don't have her bending films. She just did a side view and a front view this morning. So you see the plate, you see she's got oxygen on, and the artificial discs are centered. So we'll get bending views and we'll show those another time. As you can see, she has a much better result. She'll have active range of motion, restorative motion. She'll have no pain, and she'll be able to get her head back with her ears over her shoulders for normal posture, which is critically important to lessening pain, as I've been studying it. Some patients who have had a large fusion or a fusion of the neck are actually an excellent candidate for reversal and restorative motion surgery. So if you're one of those people, send me your pictures and I'll see if you are a candidate for a reversal.